Ron, without further ado, the guest of honor.
Well, please. Thank you, Dr. Phil. My name is Dr. Ron Yamachika. I'm a trained oral surgeon by the VA and the U.S. Navy. I practiced here in Orange County for over 40 years and 4 years active duty with the Navy. In 2012, I was having some real problems with my hip. First, I thought I had a groin injury, but after consulting with my primary care physician, he sent me, talking about to do x-rays of my knees and hips, and he said, "Wow, Ron, your right hip is roughly over 90% gone. Your left hip is about 85% gone." And wow, what happened? So finally, I found myself, I have an excellent orthopedic surgeon, and I really had to get the surgery done because I was living on meloxicam, Advils, Aleve, had access to OxyContin, but I didn't want to take that because I knew it was a highly addictive drug. So I finally had my first surgery done on my right hip in October of 2012, and the left hip December of 2013. Everything was fine until about 2 years ago. I was having a hard time standing in place, walking long distance, and I played golf a lot, and was having a hard time bending down, even to pick up the ball after a putt. I was placing the ball on the tee. So as a result of that, I said, "Well, I gotta have something done on it." So I went to see my orthopedic surgeon, and once again he said, "Well, Ron, I said, "What are my options besides, total knee joint replacement?" Well, he told me, "Well, I can inject you with the hyaluronic acid, or I can shoot you up with cortisone." Well, those are very unacceptable. The hyaluronic acid is synthetic. It's not gonna work. And you're gonna inject me 3 times a year or so, I may get some relief for about 2 or 3 months. The cortisone is definitely out because it just ruins your blood system and everything like this, throws off everything in your system. So the only alternative, he was telling me about this plasma, platelet-rich plasma, but he wasn't too, he didn't have any really details that satisfied me. So I was still looking around. Finally, I saw the ad in the Orange County Register about Dr. Phil. So I said, "Well, I'll give it a try," because he was talking about the laser treatment and the stem cells and stuff. And I'm very interested in the stem cell. I did my research, I read up on it. So finally, I went to see Dr. Phil, and I decided this was a treatment of choice. So after completing 6 treatments with the laser and the electromagnetic therapy, after the final treatment, I had a consultation with Dr. Phil, but I wanted to take it one step further. So we decided to get the stem cells. So a day later, he injected the stem cells into my knees, and it was August 29th, so a little over 3.5 weeks now, or close to 3.5 weeks, and everything's fine. You know what I mean? I don't feel any pain or discomfort. I really didn't have too much pain, but just the discomfort of standing in place or walking a long distance. And after a while, I really had a hard time playing golf. Last time I played golf was April of 2018, and that's very unacceptable to me. So finally, I had the treatments done. So it's been about 3.5 weeks, no pain, no problems, everything is fine. I'm gonna go see him next Wednesday for my 1-month check, and we're gonna go over and see how things are doing. So, like I said, I highly recommend the treatment, and you can't find a better staff than his office. I mean, they treat you strictly as a professional, which I demand anyway, being a healthcare provider myself. So anyway, like I said, it's been 3.5 weeks, everything's going fine. I feel great. I don't have any complaints or anything like that. And I have some homework to do. I got the lasers I put on my knees, that portable laser that he gave you and gives you, and then I place on my knees. So everything's going fine. I do that daily, and supposed to do it for probably 30 days or longer, whatever it is. So I'm very happy with the treatment. So like I said, if you have any problems, you can go and talk to Dr. Phil, and I highly recommend him because I'm very particular on who I go to, being a former healthcare provider myself, so I will usually go to the best, and he's one of the best that I know. Thank you.
All right. Let's give Dr. Ron a hand for that. And